We've worked in partnership with OneSight for many, many years and providing vision screening and then coming up with a plan for the children who weren't able to go out and get their vision needs met. We would be at the end of the year and come up with several hundred children every year that never had gotten their vision needs met. We knew they had a vision problem. We couldn't meet that need. Now, with this plan, we have a sustainable way to increase the services we're providing and to actually be sure that we're taking care of the needs. It's really exciting.
You know, with 140 to 200 kids failing eye exams just at Oyler alone, you can imagine the impact that has on academics. If you can't see the board, you can't read books.
OneSight has been helping in the community for over 20 years, providing vision care and eyewear, but there are still so many children falling through the cracks.
You take vision for granted when you have it, and when you don't have it, you know, you don't realize what a huge effect it actually has on you, and especially in a school setting where, you know, a lot of these children obviously are looking at, you know, materials day in, day out, reading, looking at the whiteboard, and how can they be expected to really take it all in if they can't literally take it in through their eyesight?
At the OneSight Vision Center, we're going to be able to connect the children with their providers. So it will be self-sustaining because these children have insurance. This isn't an uninsured population. The problem has been access. We're going to be able to provide comprehensive eye care services to the children of Oyler School as well as the children of Cincinnati public schools.
I really think that when we find children's needs not being met, it really draws caring people together. So I think that was the beginning point of it.
The success of this entire operation has been sort of magical in that the people who got together, both the public aspect, the Department of Health and the Cincinnati Public Schools, and the private sector, which was OneSight, Cincinnati Eye Institute, and the Ohio Optometric Association, had never really worked together prior to this project. Each of the entities brought their own resource to solving the problem.
This is a sustainable project. This is a program that we can replicate across the country. You know, two of the partners that are a part of this have national presence, and so this is a model that can be replicated in other school districts.
You know, you take them into the auditorium, everyone's like, wow. You know, you take them into the new gym, and they're like, wow. Open up the Vision Center, and everybody stops. They're like, what? There's going to be a Vision Center inside the school? Like, my kid can get a... And teachers are like, you know, they can't imagine it, because a lot of them were back with us in the days when a kid would fail an eye exam or couldn't see, and it took months and months and months to get a kid eye exam. And not to mention if the kid would break his glasses, and it'd take more months to get that taken care of. So this is the wow.